All right, everyone, welcome and thank you so much for joining us today. My name is Eugene Safanov. I'm part of the marketing team at Proficient, and I'm very excited that you've joined us for today's webinar in which we'll discuss preparing for your Oracle, Medidata, and Veeva CTMS migration project. Before we move on to a brief overview of Proficient, I'd like to cover some basic housekeeping items. All participants on this call are in listen-only mode, which means that everyone is on mute. You are welcome to submit questions to our speaker, Param Singh, at any time today. They will be addressed as time allows towards the end of the presentation. If you still have unanswered questions after the webinar or would like to request information about our services, feel free to contact Param directly. His contact information will be made available in the presentation. You can also fill out the Contact Us form found on Proficient's website. Please note that today's webinar is being recorded and will be sent to you within several days. All right, a little bit about Proficient. So Proficient is a leading global digital consultancy. We imagine, create, engineer, and run digital transformation solutions that help our clients exceed customer expectations, outpace competition, and grow their business. With unparalleled strategy, creative, and technology capabilities, we bring big thinking and innovative ideas along with a practical approach to help the world's largest enterprises and biggest brands succeed. We have a broad network of locations across the US, as well as offshore facilities in India, China, Colombia, Mexico, and Serbia. So we were founded in 1997. We're a public company that's traded on the NASDAQ, and we have approximately 4,500 employees. We've formed strategic partnerships with each of the major technology vendors and also have dedicated solution and industry practices. And one of these practices is, of course, life sciences. This slide here shows our depth of experience. You can see that we have relationships with over 30 of the world's largest public life sciences companies. All right, now that I've covered the housekeeping items and told you a little bit about our company, I'd like to pass it over to today's speaker, Param Singh.
Thanks, Eugene. Let me take control here. And share my video. Let me know when you can see. Eugene, am I good on here, on my side?
Yes, I can see you.
Okay, great. Welcome everyone to today's webinar on preparing your Oracle, Medidata, and Veeva CTMS migration project. I know that from working with and speaking to a lot of you in the past several weeks that everyone's schedule these days is even more packed than usual. So I truly want to thank you for taking part of your valuable day to join us for today's webinar, and I hope you find it beneficial. In today's title for the webinar, we mentioned a few specific names of vendors, specifically those that are leading the industry with CTMS solutions, and today's webinar will be focused on various approaches and considerations of data migration that apply to each of them, as well as considerations that would apply for any CTMS solution off the shelf or custom homegrown as well. So hopefully this information is going to be universally valuable. So let me start out by introducing myself. My name is Param Singh, and I'm the Director of the Clinical Operations Solution Practice at Proficient Life Sciences. I've been working in the life sciences industry for over 20 years and have almost exclusively been working in the areas of clinical operations to implement systems and solutions and industry best practices to help our clients achieve their vision of clinical operations, all while staying in line with industry and regulatory standards and guidelines. My team and I have led and been part of dozens of different implementations of clinical trial management systems. And these vary from implementations for pharmaceutical companies, CROs, medical device, and also range from anywhere from 5 to 10 users to global implementations of 4,500 users. And so with each type and size of organization, they have their own requirements and approaches and challenges when it comes to data migration of their operational data. And so today I'm happy to discuss some of these considerations with you on today's webinar. So as I mentioned, our team has experience with leading and working on dozens of CTMS projects. In fact, I think this number may be a bit old, but we have long-standing relationship and partnership with Oracle as a key partner in delivering system implementations of Oracle CTMS to our clients. We have an established partnership with Medidata as well, and implemented various projects, including a number of integrations with Medidata for our customers, and are currently engaged in doing another CTMS data migration. And similarly, we have a partnership with Veeva as well, and have implemented various projects, again, including a number of integrations with Veeva Vault for our life sciences clients. Being a third-party consultancy, we have a broad range of skills and experience that span across these specific leading CTMS vendors, as well as other vendors focused on the life sciences industry. We also have strategic partners with technology and platform vendors, such as AWS, Microsoft, Adobe, and others. Proficient has developed specific expertise in each of these areas to help our clients achieve success effectively and efficiently with the right resources on the projects. So now that I've introduced myself, I'd like to take a minute just to talk about my team here at Proficient Life Sciences and explain a little bit more about what we do. We provide a variety of services and products related to clinical operations. We lead and manage validated implementations of CTMS solutions, whether those are implementations of off-the-shelf applications from leading third-party vendors, or custom-built digital solutions related to clinical operations. Also, if you've seen some of our previous webinars, you know that we do extensive work with integrations between CTMS solutions and other clinical and non-clinical related systems. Our approach to system implementations is also very process-focused and holistic in nature. So we also provide our process consulting services to help organizations define and harmonize their SOPs and business processes across the organization with respect to clinical trial management. And we also offer comprehensive training services and products related to CTMS and process training course and materials as well. So this is just a glimpse of some of the services and products that we offer specific to clinical operations. And so for more information on what we offer with respect to other areas such as clinical safety and pharmacovigilance, clinical data management, clinical data warehouse and data solutions, or life sciences products and services in general, please feel free to contact me for some focused discussions. So let's look at today's agenda. Following the introductions, we're going to get right down to business and discuss strategies for determining the answers to each of these questions. Should we migrate? We're going to cover some basic considerations on this question. What the purpose of data migration could and should be. What we are, we're looking to achieve. What are we looking to achieve? What benefits that we're looking to take advantage of when migrating, and are these going to be relevant for our specific project? If so, if so, and we do look to migrate this data, what exactly should we migrate? Is the next question. So what data is being collected today in the current system, and which subset do we decide to migrate to the new system? What considerations do we need to take into account in determining, what the scope of the migration should be? Next, how should we do so? What tools are available to us for migration? What limitations do we have with the inherent tools and capabilities of each system? And then, when do we move forward with each set, of data for migration? So there's some timing considerations that need to be weighed, and a lot of these are not specific to technical limitations necessarily, but rather on process and resource related constraints. So by the end of today's webinar, you'll have a framework for performing this sort of analysis for your own organization. And as a reminder, again, as Eugene mentioned, we'll have a Q&A at the end of this session. So please submit your questions at any time through the questions feature, and those questions will come directly to me, and I'll address them at the end. So let's get started. So the first question we need to address and consider is, should we even migrate the data? We need to look at legacy data that we have and determine what are the benefits of bringing all of this data into the new system. This may include current active studies as well as historical data in our legacy systems. For historical data, one benefit is that by having this data in one central system, including historical data, we can enable comprehensive reporting across all of this data. If all the data is in one place, we can generate reports, we can view metrics, make timely decisions based on the analysis of that data. But we would also be able to do this via a data warehouse. So if all of the legacy systems feed into a data warehouse solution, this benefit alone may not be enough to make the case for migration for your organization. The second one listed here is also related, where we can have a complete side-by-side live picture of each study in one system to be able to perform the same type of analysis and understand how we're trending as an organization with regards to our process for clinical trial management. For current and active studies, the benefits include the ones that we just mentioned, as well as the benefits that affect current operations. So migrating active studies, that's going to enable your workforce to be able to work within one technical system and one set of business processes. When we implement a new system, we usually implement some modified processes as well. And with migration of all of your current studies, we can ensure that everyone is working within the same process, and there's less confusion and complexity having to have resources potentially trained on 2 or more different systems. From an IT and support perspective, migration and coupled with decommissioning of legacy systems reduces the overall cost of support and maintenance of these systems. If we don't migrate, we will have our IT staff supporting multiple systems, which includes maintaining the hardware as well as support tickets from the users. Long-term, maintaining both systems is going to be a costly approach. And so migrating can help decommission that legacy application quicker and reduce your overall cost. So now, we know the potential benefits of data migration, and for each organization's, the value of these benefits will need to be determined and weighed against the risks. So let's look at some of those potential risks of data migrations. There may be some loss of functionality in the new system. For example, if you're implementing a new CTMS in a phased approach, you may not have all of the integrations in place. You may not have all the automations in place, or specific enhancements in place to capture and track certain data, which you were able to do in your legacy system. So if we can't find a if we can't find a place to migrate that data to in the new system, there could potentially be some loss of data. This could be loss of data in that scenario where there's no target to the source attributes, or the data is represented in a slightly different way. So we need to either cleanse, or we need to transform or translate that data during that migration process. With any data migration, timing is key. So the go live of a new system, when the data is migrated, when the data is available to the users in the new system, and all things to consider in the rollout. In certain situations, there may be lag time, essentially. So for example, the system may be live, or the new system may be live, and we just migrated the study, but the study team has yet to be trained, so they don't have access to the new system yet. which will create some lag time. And during that time, they're not able to manage their study in the old system either, since that study's already been migrated, and any changes that they make in legacy, if they still have access to it, it won't get reflected in the new system. So this is something that the deployment team needs to consider to ensure minimal lag time for migrated data. Time overlap is related to that example as well. So if a company allows users to be in legacy and or both systems post migration, again, there's going to be that disconnect of data. So there has to be a clear directive on how to use migrated data to minimize and mitigate those risks. So this slide just shows an example of different types of organizations and the different factors that they need to consider when taking on data migration initiatives. There's no secret formula to when you should migrate or when you shouldn't, but certain factors will weigh in more than others at various organizations. So, you know, with this example, we have a growing CRO who, you know, large-scale studies are planned or are already started. They have limited resources to manage these studies and limited IT resources to manage systems and tools. So, you know, I don't know how many systems they currently have, but if the studies with this new client haven't started yet, they may not need to migrate anything and just focus on launching the CTMS in time to get the planned studies on the new system. For the oncology company example on the right, they already have some long-term trials that they're managing, and there's a considerable amount of data in the legacy system, and these legacy studies are long in duration. So that may make the case to actually migrate all of that data. But if they're thinking about doing this for, again, just reporting and metrics purposes only, you know, they've also recently implemented a data warehouse, so they can get their consolidated data across studies in both systems via the data warehouse. So again, the decision is not always black or white. There's going to be several factors that go into it, and some of the factors may be more important to one organization than another. So let's look at the next question, which is what should we migrate? And this scoping should take place on two levels. One is at the study level, so which studies should be migrated, and from those selected studies, which data types or records should we migrate? So first, we need to look at good candidates for migration from a study perspective. You'll first need to take into account the benefits you specifically are looking for, as well as from the previous question. Initially, you know, you may look at historical closed studies first and whether you want that data in the new system for reporting purposes, or whether the legacy data is already in or planned to be in a data warehouse. Next, you'll have to consider your CTMS go live date and the end dates for current and planned studies. So if you made a decision that historical data can stay in the legacy system, then short-term studies will typically fall in that bucket as well. So, you know, since there will be little overlap if the studies end shortly after the new system goes live, the easiest thing to do is just to let those studies end in the legacy system. That leaves long duration studies, which in many cases would be a good candidate for migration. The other thing to consider, other than the effort to do the data migration itself, is the inevitable data cleansing effort that needs to occur usually before the migration. So for the data that doesn't map directly from legacy to the new CTMS, your business team will have to find a way to retain that data or migrate it somehow. So also for that data that doesn't meet your newly defined data standards for the new system, there will be a cleansing effort to transform or translate that legacy data into the standards of the new system, the standards that the new system is governed by. A simple example of this is that we see is in address data. So contacts and accounts and addresses, you know, where addresses, where you have a new standard where the street prefix, the street is spelled out instead of abbreviated ST period, for example. So those are simple examples of implementing data standards that you'll have to account for during the migration process. For current studies, consider the size and the amount of the data that's already collected. The more data that's collected, the more data that will need to be cleansed and migrated. So this slide illustrates the examples I mentioned in the previous slide. So, taking a study by study approach, we look at studies that are ending soon and realize it would be more effort to migrate them rather than just letting them run out in the legacy system. On the other side, there are studies that are starting soon, and by the time we go live with the CTMS, these studies will have very little data captured. So it's easier just to enter that data in the new system when we go live, so we won't need to potentially migrate those either. For the middle box, for the long duration studies, there's already considerable amount of data, and these studies are going to run through for several months or up to a year, post go live of the new system. So we don't want to be in the old system for that long, and so we will migrate these studies to keep our desired legacy system cutoff date. Okay, so now that we've narrowed the scope from a study perspective as to which studies to potentially migrate, now we must define the scope of the data types or the records within those studies that hold the information that we want to migrate to the new system. So for this, we need to determine what do we have available to track in the new system. There may be cases where you're tracking something in your legacy system which doesn't necessarily have a clear target in the new system. So we need to determine what data has a placeholder in the new system. And I won't drain this slide here, but these are some of the examples of the data elements that we typically see from a CTMS migration. And the point here is to consider everything that could potentially be migrated into the new system. And this next slide looks very similar. Once we examine the target, we need to look at the source or sources, if there's multiple, as to what you're tracking in your legacy systems or other databases or trackers or documents today. So as you review this, you may want to consider some reasons not to migrate data. One reason could be that we're not tracking a particular data type, so there's nothing to migrate. Another reason could be that the target selected CTMS doesn't offer that functionality to track the data type, and so we're not going to be able to migrate there as well. And another reason could be that you have an existing tool or tracker that you're happy with, and so that data is not going to, we're not going to use that functionality in CTMS, and we're going to retain it in this existing tool. So all of these decisions would need to be made across all of the data to determine the overall data scope. So now, you've made a clear mapping of data types. You've identified what actually can be migrated. Now we might look at the business need for that data in the new system. When we're looking at the business needs, we consider data needed for historical studies as well as current and active studies in all cases. So some of the examples that are listed here, there is no business need to potentially migrate historical correspondence records. There's no reporting needs for that data going forward. Another example is that adverse events that were tracked as part of monitoring in the legacy CTMS, but really the safety system is the ultimate source of truth for that data. So we're going to make a business decision that we don't need to migrate those records to the new CTMS as well. And some acceptable workarounds of business process or business process decisions could also be determined, such as trip reports. While trip reports and site visit records are typically migrated from CTMS to CTMS, anything that's approved trip reports can be printed and archived or filed in your electronic trial master file instead of migrating that to the new CTMS. So we've covered, whether we should migrate, what specifically is beneficial to migrate, and so now it's time to ask, how are we going to go about doing this? So to answer this question, we must first see how many sources of legacy data do we have. A number of unique sources can dramatically increase the effort of the migration. We can be dealing with multiple CTMS systems on an actual, sort of relational database, or we could be dealing with a number of Excel spreadsheets, custom trackers, Word documents, things in a document management system. So there could be a number of different sources of data that we want to migrate into the new system. And sometimes data migration can be a two-step process where, data from these tools, such as, Excel spreadsheets and other trackers, are actually entered into a true legacy CTMS system, from which then we migrate all of the data into the new system. So migration from each of these individual spreadsheets and, MS databases and others, even multiple custom CTMS systems in various formats is going to be costly. So along with data cleansing process, we also typically employ a data consolidation effort, which will combine that data into one legacy format from which we build our automated migration routines from. And that way, we validate one specific approach and source for that migration. Additional considerations on how we should migrate include determining the volume of data for each record type that you're looking to migrate. So if the volume across the system is quite low, you may consider manual data entry into the new system rather than configuring a migration routine or program for that entity. Remember, most migrations are just one time, so that one-time cost for building a migration program needs to be understood. When doing large projects like this, validation efforts are a huge part of the effort and cost. So looking at manual front-end data entry or manual migration options where validation isn't necessarily required should be considered. Additional considerations that need to be understood are the level of or the complexity of the transformations of the data during migration. What are the relationships of the entities in both systems? Do they match? Are they similar? Or are you going to have to transform that data into target relationships of those entities, which can be pretty complex. So you must also review attributes as whether and whether you have a good mapping between the two systems. And also the data standards. Are the data standards in line between both systems, or do we need to cleanse that data prior to migration? Again, a good example that we mentioned before is how addresses are tracked in both systems. And another example could be list of values. List of values, drop-down values in both systems for similar fields could be different. So how do we translate that as part of the migration? The next area to consider are the tools and methods that are available for data migration. We always have the option for manual migration, like I mentioned before, where we recognize the need for that data from our legacy system, but we don't necessarily code or automate those routines to migrate that data, but potentially rather get data entry folks and resources to key in that data before go live in the new system. This may end up being a less costly method to migrate depending on the volume of that data. Historically, we actually had an organization hire temp data entry personnel to key in over thousands of contacts in their new system instead of building a series of migration routines that would pull their contacts from various sources. And so they ended up actually saving money going with that manual approach. Obviously there are some risks associated with manual data entry as well, but they chose to go that route because it was in their specific case, it was a cost-effective approach for that part of the migration. And then when looking at automated options, you have to consider the embedded tools in the systems that enable migration, such as EIM, Enterprise Integration Manager for Oracle Siebel applications, for example, or CSV or XML imports for other cloud-based CTMS systems such as Veeva Vault and Medidata solutions. You may also consider the existing tools that your organization already owns licenses to, such as Informatica and SSIS and other ETL tools that you can use as part of the migration, or you may need to build out custom migration routines to transform that data appropriately. And of course, when selecting a tool, you will need to consider various constraints such as budget and time and complexity. So the next few slides I put together, have some visuals on the technical approaches that are typically used for an end-to-end CTMS data migrations. This first one is the one that historically we saw most often, which is the in-house CTMS to a new in-house CTMS solution with legacy CTMS solutions installed and managed in-house, and then replacing them in-house with either a custom solution or another off-the-shelf solution that was installed in-house, right? So your IT within your IT infrastructure and supported by your IT staff. So this is, this we saw historically, very often. So this is the typical flow of data in this general technical approach. Again, we still have, we have a legacy CTMS. We have some external trackers, so we want to load those directly into the legacy CTMS, migrate the study data into a staging environment, utilizing some of the tools that we talked about in the previous slide, doing some deduplications, transformations, cleansing into final staging tables that ultimately get loaded directly into the new CTMS database. So really a database to database kind of typical migration approach that we typically saw historically. This next approach is going from an in-house CTMS to a standard cloud CTMS. Now this is probably the most common approach right now, with more standard cloud-based CTMS solutions available from vendors such as Veeva Vault CTMS and Medidata CTMS. More companies are finding this option to be advantageous for their business. The key to data migration to cloud solutions is that you have to format that data to the required format that's going to be accepted by the target solutions import tools. Typically with these types of CTMS solutions, the format for the imports is standardized and can't typically easily be customized, right? So it's a standard published approach and format, and so you need to adhere to these formats to do and execute a data migration. For example, for Veeva Vault CTMS, what we have are published CSV formats that are defined for the Veeva data import process, and then for Medidata CTMS, what we have are published XML formats that are defined for that data import process. So, typically we use ETL tools such as, again, Informatica and others to extract that data from the legacy databases and transform that data into these prescribed formatted files, which will then be transferred to the cloud CTMS vendors infrastructure and then run the import process to complete that migration. So this is the typical flow for in-house to standard CTMS, standard cloud CTMS. And this last slide illustrating these approaches we've illustrated here is the in-house CTMS to a customized cloud CTMS solution. This is, again, slightly different than the last approach. I mean, we still have a cloud-based CTMS in that, but the cloud solution is customized for the business. It has been customized and configured specifically for the organization, and the automated migration solution would be built and validated as well to conform to this customized solution. So this is meant to be both usable for a one-time migration and fully reusable for ongoing data transfers to the target solution from other data sources as well, such as a CRO feed and additional sources from company acquisitions, for example. And so we've actually deployed this type of solution for large global pharma companies that are using this setup, and it saved them a lot of money and effort to reuse this approach for ongoing data transfers. So we have our legacy database, and we've done this sort of extract, transform, load. We've built a custom reusable migration solution that sits in the cloud essentially, and so we're formatting standard data to be used with that. And so you can actually run multiple sources. So here we have, we migrated their CTMS one time and ran this migration, and then we are reusing it to do daily feeds, CRO feeds directly through the same migration approach. So we're reusing a lot of what we've done to from a migration perspective to almost come up with a batch type of integration that we've built around CRO data feeds. So the next thing is timing. Timing is a very important aspect of migrations. There are, of course, multiple options on when you can migrate your studies from the legacy system to the new system, but these need to be in line with other key decisions such as the training approach and training rollout and legacy decommissioning strategy. Big bang migrations are when you decide to move all of your studies that have been selected for migration at the same time and push a button and migrate those over together. This would make sense if the users of the system are also getting trained in a big bang deployment. So if you're doing a pilot rollout of users, then you would want to only migrate studies based on the study teams and the users that have been trained on the new system. So there's no sense in migrating everything if those specific users are not trained and therefore not going to be in the new system to manage their study data. So where we've seen great success, especially for larger organizations, is a phased study by study, joint training and migration rollout. This allows organizations to work out any minor issues in the process and increases user adoption as well overall. This is, in some cases, is easier to manage as well since you're training smaller groups of users at a time. But however, if IT or the support organization can't temporarily support both the legacy system and the new CTMS system together, Big Bang may make sense, right? So there, again, certain things need to be considered as you make decisions around timing. So in summary, we've discussed the 4 aspects of CTMS data migration analysis. We really have covered all the steps each organization needs to take before undertaking a migration initiative. There needs to be thorough planning and analysis to any data migration before we can understand the full scope of the initiative. First is the purpose, defining the business benefits early on, as this is the driver to define the rest of the migration initiative. This is probably the key takeaway here, is really defining that purpose across all of it. Your scope, your data scope, take strong consideration of the data that you need to migrate and how it aligns to the overall business benefit that you defined in the purpose. Method, take stock of the tools and resources that are available to you, which methods are going to be required, based on the target system. You never want to rule out a manual migration, even if it's partial, since the cost for a fully automated migration, could be potentially a one-time cost. And if there's, if there's not an opportunity to reuse what is built for ongoing data transfer. And then timing, consider the rollout strategy, the training approach when determining the overall sort of migration strategy, as all these need to sort of align with each other. You can't decide one without impacting the other. So as we close out today's webinar, we wanted to share some service offerings our team has created for our client partners. Our team has developed 2 jumpstarts to help your organization determine how to approach CTMS data migrations, again, regardless of what the source and target systems are. With our level of experience and expertise with this first jumpstart, our team can develop a CTMS migration implementation scope analysis, which will include detailed timelines, milestones, process and data flow diagrams, as well as the overall cost and effort for the data migration initiative. This specific jumpstart is free of cost and around 2 weeks of effort, depending on how many different sources and different departments within your organization that we have to interview to develop an overall scope analysis for a data migration project. And the next jumpstart is more detailed and provides your organization with additional tangible deliverables that can help you develop the overall scope analysis, as well as strategy and detailed plan for the data migration. So this specific jumpstart includes the scope analysis, but also includes identification of the CTMS data entities for migration, the draft migration validation plan and protocol, as well as the draft migration requirement specification document as well. These are documents that you're going to need as part of your data migration implementation project. So this specific jumpstart, which is a short paid engagement, provides these additional deliverables for your organization to really get a head start on the implementation. So if you'd like to discuss these options in detail for your organization, please feel free to reach out to me directly, so we can schedule a detailed discussion to determine which option may be right for your organization. So that brings us to the question and answer portion of our webinar. So again, if you have questions, please submit them through the questions box, and I'll do my best to try to answer them. So let me go into some of the questions.
Yeah, but at the moment doesn't look like we have any questions,
Yep.
So we can give it another minute and see if anyone has them.
Sounds good. And if you're having any issues with submitting your questions in that question feature, you could also use the chat if that's easier. While we're waiting on questions, Eugene, is just to confirm, this webinar is being recorded, right?
Yep.
And you'll get the link for that recording.
Exactly. So we are recording today's webinar. We're going to send it out in the next couple of days, hopefully today or tomorrow, that you guys can review and share with your colleagues. And there will also be a link to the actual PDF of this presentation as well.
Great. So it doesn't look like we're getting any questions. So should we close out here, Eugene?
Yeah, I think it's a good time to close out. So I'll just say that again, you'll get the recording in the next day or so. You are welcome to visit, proficient.com to see, check out our thought leadership. Make sure you visit our social media pages. You can, register for additional upcoming webinars and download our guides. We are in the process of scheduling a number of additional webinars, specifically around clinical and safety. So definitely check those out and register if you can. You'll also get the recordings if you can't attend those, of course. So, Parm, I don't know if you have anything else to say, or if you.
No, I just want to thank everybody for sharing the past hour or so with us, and I hope you found the information useful.
Great, thanks for joining, everyone. We look forward to having you in the near future. Take care.
Thanks.